Good evening, friends. This is Dr. Good evening, friends. This is Dr. Reema Das Mallik. I'm a clinical cosmetologist. Today we are here to discuss an important topic that is hyperpigmentation. Now, hyperpigmentation is a very common problem in Indian type of skin because we have naturally good skin and we are blessed to have a natural pigment that God has given us that is known as melanin. Now, melanin can cause hyperpigmentation if it. Today, we are going to discuss about all those through and what can be the possible treatment modalities that we can look up to. Now, when we talk about hyperpigmentation, most of the people, most of the patients, they say, it's ma'am, we are having pigmentation, ma'am, we are having dark spot, ma'am, we're having black patch. So no one wants anything which is uneven. It's not about the complexion, but the thing should be even out. So in our country, we can see that there are lots of hyperpigmentation problem, and especially since I belong to Northeast, I can see patients who have a lot of hyperpigmentation issues, starting from freckles, melasma, post-inflammatory hyperpigmentation, periorbital hyperpigmentation. There can be so many things. Good evening, Arindam. I think you can hear me. Do You are free to ask me any kind of questions. If you don't understand, I'll try to make you more. I will try to make it more easy. So, on a layman term, what is hyperpigmentation? Hyperpigmentation is any kind of hyper means more. When in your body, in any part of your body, you can see any dark patch, any black spot, that is hyperpigmentation. That area of your body produces more of melanin. Now, what is melanin? Melanin constitutes normal natural pigment that gives color to our skin. People who are very fair, they have less melanin in their body. Those who are darker have more melanin in their body. Now, people who have melanin in their body, they are less prone to develop many more skin issues, including skin cancer. So, we say that we are blessed by God to get a natural sunscreen. We always emphasize the use of sunscreen because the radiation that comes from the sun, that can really damage our skin, and most of the skin issues develop from that sun rays. Okay, so coming to hyperpigmentation can be of very common type of hyperpigmentation that we encounter in this part of the country is melasma. What is melasma? Melasma is patchy pigmentation, patchy discoloration, or rather you can say blackish discoloration of your skin over forehead, over cheeks, over chin also, sometimes over around the perioral area also, and it at times it gives a it happens in the nose also. And whenever there is any injury, especially if you do girls who are used to doing threading, you can have hyperpigmentation over these melasma happens because of hormonal changes in our body most of the time. It's not that always it happens so, but most of the time melasma happens during pregnancy, post pregnancy, and postpartum also. And it is also seen in some people who take hormonal pills for various reasons. But in we have also seen melasma in many male patients. So it has not been it cannot be said that it is only because of the hormonal changes that we can develop melasma. Melasma is very difficult to treat. You need a lot of treatment modalities, and There is no sure shot treatment for this. Some people respond to tranexamic acid, oral tranexamic acid. Some people respond to chemical peels, glycolic peels, lactic acid peels. Some people they respond to a lot of effort like lasers, a lot of skin lightening agents. So there are lots of treatment modalities available for melasma. Second most common thing that we encounter is overall skin discoloration because of exposure to sun. We call it tanning, skin tanning. Now your skin tanning happens when we go to the sun, and we don't apply sunscreen. Now some people say that I don't get so exposed to sun, but still I get tanned. That is because you have a tendency, your melanin is more in your body, and when you stay indoor you are fine. But even if you the screen, the radiation that comes from the screen that we use mostly these days, from laptop to mobile, these can also lead to this overall darkening of the skin because of increased production of melanin in those part of the exposed part of your body. So these treatments are also similar. Like there are skin lightening agents, there are antioxidants that can decrease melanin synthesis, like glutathione, which is a very popular treatment these days. There are glutathione soap, there are glutathione cream, gel, even injection, tablets, lozenges, spray, whatnot. So there are a lot of options for all these. Then there is a pigmentation which is known as freckles. Now, what is freckles? Freckles is like pinpoint pigmentation you will see on the cheeks, mostly in in our part of the country, northeast people, people from hilly area, they develop this kind of pigmentation more. That is known as freckles. Freckles are this pin drop kind of a pigmentation that is developed on the exposed part of the body, that can also be treated by lasers, Q switch laser, pico laser. There are lots of lasers these days. So we can treat freckles easily. It is not as difficult as melasma. Now some people, mostly they come with under eye dark circle, peri-orbital hyperpigmentation. This area is hyperpigmented. Now there are various reasons for it. At times the reasons are such that we cannot help much, but uh, some people, they say that when we were applying such and such thing, such and such cream, it was fine, now again it has come. So why these things happen, why it comes back? Because some problems are such that it cannot be taken care of totally. Because one of the reasons for periorbital hyperpigmentation is also superficially placed vessels. Now if the blood vessel is very superficial and your skin under the eye is actually thin, you will see a bluish discoloration. It is not pigmentation, but it is bluish color of the vessels that you are being you can see. So these cannot be treated. What we can do is we can massage the area and increase. We don't allow blood to pass sluggishly, and that we can do. So that is why whenever we give an under eye cream, we ask you to massage the area with your fingertips, so that those lymphatic drainage is also proper. You don't end up having a lot of edema. It's not, we won't say it edema, but yes, those saggy feel, and that swelling under your eye can be taken care of by a little bit of massage, if it is because of the stagnation of water retention, or stagnation of lymph. But if it is because of the fat prolapse, that is also a common cause. With age, our fat prolapse is very common. So when there is fat prolapse, nothing helps. You will have to undergo blepharoplasty. The ophthalmic surgeons, plastic surgeons, they do blepharoplasty for under. They also complain of too much of dark color under their eye. It's like blackish color of colored pigmentation. It can happen because of use of too many cosmetic product and not cleaning it properly. So it is very important to remove your makeup with a very good cleanser. Nowadays micellar water is very popular. You can use micellar water to remove your makeup, especially from your one of the basic thing that we as an individual should do to avoid hyperpigmentation, because our skin is more prone to develop it. No one wants a patchy skin. No only thing that can help us is application of sunscreen. Know that we have to reapply the sunscreen, because if we think that if we have applied in the morning, all throughout the day will be fine, that is wrong. You will have to reapply the sunscreen after every 4 hours if you are indoor, and if you're outdoor, then you will have to reapply it after 2 hours. So it is very common. And after sunscreen, at night you can apply a lot of, there are a lot of skin lightening agents like kojic acid, azelaic acid, glycolic acid for that matter. There are these are the chemical agents that can help you decrease your pigmentation. You should know that whatever drugs, whatever medicine your doctor is prescribing, be very sure to ask and to see the prescription properly, like up to what time should you apply it. At times we give you certain medication to apply only for certain period of time, like for 15 days or for a month, but we end up applying it because we see good result, but we don't know what damage certain products can make to your skin, like too much, too many use of hydroquinone, too many use of steroids containing drugs can actually damage your skin and make your skin vulnerable to more damage from sun, because it can lighten your superficial layer of the skin, that is a stratum corneum, which saves us from a lot of things. So we should be very careful about what we are applying, and please don't self prescribe, and please don't try to suggest someone to use that you have seen good result with. Let people take a consultation from a cosmetologist or dermatologist, so that they know what is the problem and why it is happening, and then treat it. Now some people also, it is very common to have acne, right? Some people say that we don't even touch acne, but we end up having so much of pigmentation after this acne. So that is something which we have to look up to. If you have too much of pigmentation following acne or any kind of injury for that matter, you should there are a lot of treatment options available. You should treat yourself. There are a lot of treatment that can be done for those things also. So the good thing is, though there are so many problem, there are so many manifestation of hyperpigmentation, the good thing is there is treatment available, from chemical peels to glutathione injections to laser treatments. There are so many things that are available now, so we did not worry, and we should actually take care of our skin in terms of applying sunscreen, in terms of hydrating our skin by moisturizer, so that it is not prone to get damaged easily under the sun. And yes, even if you are indoor, you must apply sunscreen, and you should also apply a good antioxidant serum, especially on summer, because this is summer. I'll emphasize the use of vitamin C. If you use vitamin C along with sunscreen in the daytime, it will accentuate the action of sunscreen, and at night you can apply vitamin E containing serum. And if you are above 35, you can apply a retinol based serum, so that it gives you an anti-aging effect also. So there are lots and lots of treatment options available to keep looking good and beautiful and be the best version of yourself. You can actually get a smooth spotless skin, but you will have to be regular in your skincare regimen. So we should know that whatever problem we are suffering from, it is treatable. There is nothing to worry, and we need a disciplined life. Now someone who doesn't sleep well, who have extremely stressful life, they cannot complain of dark circle. They will have dark circle, that they also know, right? So your skin will glow when you have a disciplined life, from taking a balanced diet to moderate amount of exercise, to drinking proper water, keeping yourself hydrated. And the three things that I always swear by is cleansing, moisturizing, and protection, that is sunscreen. So sunscreen should always should apply a good amount of sunscreen. Good evening everyone. Don't we have any question till now? we can always, I am open to any kind of question that we have. uh, and we have, I think we have touched almost all the topic, but yes, certain things like we are mostly we mostly look forward to what are the things that we can use from our kitchen. We are more concerned with that, like, right, Indians, we love to use something from the kitchen on our face, because when, especially when it is a holiday, we want to apply certain face packs which is soothing to our skin. Now, for pigmentation, since we are discussing pigmentation today, the best thing is curd, because curd contains lactic acid. Lactic acid is a chemical, it is used as a chemical peel also in the clinic, and lactic acid is present in curd. So curd, we can mix it if we have a very dry skin. You can mix curd with honey and you can apply it on your face. And if you don't have a dry skin, and if you have a oily kind of a skin, you can add one 2 drops of lemon also, and with the curd, and little bit of you can apply the honey. You decrease the amount of honey that you should apply, because honey is again a moisturizing agent. It can act as a very good hydrator. But if you have oily skin, if you have tendency to develop acne, then don't apply too much of honey. For too much of this post-inflammatory acne, post-inflammatory hyperpigmentation following acne, you can apply any kind of multani mitti or sandalwood paste, so that the spot releases fast and your skin also, like you are having acne also and you are having pigmentation also, you can add natural things like neem. It is an excellent antiseptic. You can add haldi, you can add tulsi along with the sandalwood paste. So these are all natural things that we can do to get a flawless skin. So I think this is useful to you. We will meet again. So keep shining, keep looking good, and keep having flawless skin. Thank you so much.